I want to talk to the men about an association of a type of male hormone called DHT. So this is a form of testosterone. So I want to talk to you about the connection between that level of DHT and having problems with Afib, atrial fibrillation. Now this is a connection that is a bit known, but not completely understood, actually, the mechanism. So we'll go into what we do understand, and most importantly, something you should know, because Afib is not only scary, but it can lead to invasive procedures that you might not need if the root cause of your atrial fibrillation is a DHT imbalance. So DHT stands for dihydrotestosterone. It is the most potent form of testosterone that your body makes, and about 10% of it is converted. So testosterone, about 10% of it is converted to DHT, and that is totally normal, and you're supposed to have it in utero as a little boy, as well as in puberty. It's developing male sexual characteristics. But as we get older, or as you get older, it can lead to issues with the prostate, male pattern baldness. So what's key here is the level. And there's always a sweet spot. There's always that Goldilocks area for any level of blood levels, regardless of what you're measuring, whether it's hormones or something else. So too low is no good, too high is no good. And interestingly, both low and high are associated with Afib. So some of the reasons you can have high DHT is because of aging is one, not something you can do much about, but also having prostate disease. So if you're having either inflammation or hypertrophy of your prostate, or you have prostate cancer, so that can lead to elevated DHT. But so can things that are more simple to correct, like a poor diet, being under a lot of stress, alcohol consumption, smoking. So these are all lifestyle factors, obviously, that you have control over, and that can start to moderate and normalize your DHT levels. Now, what about low DHT or low testosterone? Because if you have low testosterone, you're going to have low DHT, because it's the testosterone that's converting to the DHT. So again, we have age in the low testosterone levels, but also being on statins or opioids. Statins is something we can mostly do a lot about, normalizing the reason you're on a statin, so that you don't necessarily need it. So that's something we have control over. Also, a lot of the comorbidities that so many Americans have, like obesity, diabetes, kidney disease, and heart disease. So things we can start to help assuage, which will then raise your testosterone. In this case, we're talking about lower testosterone. And there's always drugs that are associated with both low and high, and specifically drugs for the prostate can lower your testosterone and therefore your DHT. So the mechanism associated with Afib, as I said earlier, is not completely understood, but what they do understand thus far is associated with inflammation, clotting factors, so your platelet level will change, also the elasticity of the blood vessels, and the electroconductivity or electrical signaling of the heart, because atrial fibrillation, that's what it's about. It's a rhythm issue electrically in the heart. So it's exciting to know this, and the other thing I wanted to mention is that men with high DHT can be taking a form of testosterone to enhance their low testosterone. And again, that's perfectly safe, but one has to look at the mechanism of what type of administration of testosterone is being given, how much is being given, and if you really balance all of those issues while making the lifestyle changes I just mentioned, and we could really get a good handle on perhaps why you have atrial fibrillation. So I wanted to share this. I had done an earlier video on atrial fibrillation associated with hiatal hernia syndrome, which is predominantly what I talk about. on this channel, but we were actually going over a case, my team and I, about a man with atrial fibrillation who had actually very high DHT, and who's already doing better now that we're modulating that. So I wanted you gentlemen to know about that. So if you are a man with AFib, or you're someone who knows a man with AFib, this is something we really want to delve into. And it's sort of the classic root cause approach, right? You don't necessarily think of hormones and heart, but there's no part of the human body, honestly, that's not communicating with every other part to a certain degree. And this really epitomizes that, is showing about, diabetes and obesity and a poor diet and stress, and what your testosterone levels are doing are all contributing potentially to this issue. So I hope that was helpful. If you like the channel, please give it a thumbs up and subscribe so more people can see this content. And if you're ready to get healthy, whether you're suffering from AFib or you're just overall general health needs improvement, and you like the approach of getting to the root cause, then definitely reach out and we can set up a consultation for you.